Good afternoon. This is Mark Keegan. I'm the Division Chair of Multiple Sclerosis and Autoimmune Neurology at Mayo Clinic in Rochester. And today I'm going to be discussing advances in the diagnosis of multiple sclerosis. These are my disclosures. I work on the editorial board of MS and related disorders. And I have royalties from a book called Common Pitfalls in Multiple Sclerosis and CNS Domain Diseases, some of which I will discuss within this talk. Just as an outline to my talk, first of all, I'm going to discuss in some detail the very formal criteria of multiple sclerosis and its more recent revisions in 2017 that are known as the McDonald criteria for multiple sclerosis. Secondly, I'm going to discuss the important topic about misdiagnosis in multiple sclerosis, which continues to be a concern in our field, despite advances in diagnosis of multiple sclerosis. And this is an important topic with significant implications for our patient care. And lastly, I'm going to talk about how I actually operate in the clinic and how I make a diagnosis of multiple sclerosis with a very simplified three-step diagnosis to share with you. Now, first of all, as my colleague, Dr. Weinschenker, has pointed out, to make a diagnosis of MS, you really have to establish that the disease is both disseminated in time, meaning it comes at different times, and within space in the central nervous system. The other thing about it is it must be idiopathic, and there's no better explanation for the cause of it than multiple sclerosis. Now, there is some question about whether the dissemination in time and space are necessary or even sufficient to make a diagnosis of MS, and for a couple of reasons. One is the symptoms, signs, and sometimes even the radiological findings may not be entirely specific for multiple sclerosis. There might be other causes. Next is when you look at the diagnostic criteria for multiple sclerosis, really it's predicated on those that are important for the initiation of disease-modifying therapy, or DMT, for multiple sclerosis. And it's also important that these are evaluated on patients with a very characteristic symptom or first clinical symptom of multiple sclerosis known as a clinically isolated syndrome, or CIS, not on general neurology patients who come with many different concerns. Well, in 2010, the initial